Why would a doctor recommend a cystoscopy? Have you ever wondered why a doctor might suggest a cystoscopy? This procedure is quite important for understanding bladder health. A cystoscopy involves using a thin tube with a camera, called a cystoscope, which is inserted through the urethra into the bladder. This allows doctors to visually inspect the bladder lining and urethra for any issues. One of the main reasons for recommending a cystoscopy is to evaluate urinary symptoms. If someone has persistent issues like blood in the urine, frequent urinary tract infections, painful urination, or difficulty urinating, a cystoscopy can help identify the underlying cause. These symptoms can be concerning, and a direct look inside the bladder can provide clarity. Another critical reason is the detection and monitoring of bladder cancer. Bladder cancer often shows up with symptoms like blood in the urine or irritative bladder symptoms. Cystoscopy is considered the gold standard for diagnosing bladder cancer. It allows doctors to see suspicious lesions or tumors directly. For patients with a history of bladder cancer, cystoscopy is essential for monitoring and detecting any recurrence. Cystoscopy is also useful when imaging studies, such as ultrasounds or computed tomography scans, show abnormalities in the bladder or urinary tract. In these cases, cystoscopy can clarify the diagnosis by providing a direct view. Additionally, for individuals with chronic cystitis or unexplained urinary tract infections, cystoscopy helps assess bladder inflammation. It allows doctors to examine the bladder lining for signs of inflammation, ulcers, or other abnormalities. Cystoscopy can identify structural problems too. It can reveal strictures, which are narrowings in the urinary tract, bladder stones, or even foreign bodies that might be causing urinary symptoms. This information is vital for determining the best treatment options. Sometimes, cystoscopy is not just for diagnosis. It can also guide minor treatments. Doctors can perform biopsies of suspicious areas, remove small tumors, or extract stones during the procedure. Generally, cystoscopy is a safe procedure. It can often be performed under local anesthesia to reduce discomfort. While it is invasive, the benefits typically outweigh the risks, which might include infection or bleeding. In summary, cystoscopy is a crucial tool for diagnosing and managing bladder health issues, including bladder cancer. It provides direct visual information that other tests cannot offer. Patients should always discuss the reasons, benefits, and potential risks of cystoscopy with their healthcare provider to ensure they make informed decisions about their health.